All right. Thanks everyone for tuning in this Choir Nerd podcast. Apologies for such a long delay since my last drop. It's been a wild season full of recording, pandemic recording. If you follow this podcast on Facebook, you might have caught that this podcast was featured as one of the 20 best choral podcasts of 2021, according to Whelp magazine. So I'm not sure how that really gets assessed, but thanks for your interest in getting that podcast on that list. Today, I'm pleased to have, now, is it laryngologist?
Very close. Laryngologist.
Laryngologist.
Yes.
Yeah, that's a word I've never had to say before. Dr. Neel, and then how do you pronounce your last name?
Bhatt.
Bhatt. Dr. Neel Bhatt. He is the assistant professor at the University of Washington and focused on advancing the understanding of neuromuscular changes to the larynx with aging and neurodegenerative disease. He is working to develop novel regenerative therapies to improve patients' quality of life with voice, swallowing, and breathing disorders. Thank you, Neel, for being on the podcast.
Thank you for having me. This is fantastic.
Before I ask you what all that means, can you tell us a little bit about yourself, how you became interested in this topic, and what you're currently working on?
Sure. Well, great to be here. I am a physician and surgeon, and my field, like you said, is laryngology, which is the study of voice, breathing, swallowing, everything to do with the larynx and the upper aerodigestive tract. I completed residency, so after medical school, in a field called otolaryngology, head and neck surgery. And I finished that at Washington University in St. Louis, which is really confusing because there's a University of Washington and a Washington University. So, and then I did a one-year fellowship under the instruction mentorship of Dr. Michael Johns at University of Southern California, which was heavily focused on the care of the performing voice, singers, and now I've been here for about a year at the University of Washington. So my practice, while it does have a focus on performers and singers, I also am looking at all different types of people, people with voice disorders, with aging, neurodegenerative disease, cough, globus sensation, which means you feel something in your throat, breathing problems, and everything associated with it. So it's a pretty robust practice, despite being a very focused area.
Yeah, that's interesting. I mean, but is there something that just drew your attention to the voice box? Like, is there a cool story to share there somewhere?
I think that with a lot of people in the medical field, has a lot to do with the people you're around, your mentors, people who get you excited. And for me, I grew up playing piano, guitar, was in band, and took some voice lessons for a little while. And I thought it was a good marriage of, the science, and then there's a lot of art in our field too. And the best part is, when it comes to voice, breathing, swallowing, those are such fundamental things that you do every day. And a lot of times our treatments, surgeries can have an immediate impact on someone. And I'm obviously biased, but I think it's the coolest field because you can immediately help someone in ways that maybe they had just accepted as their new normal.
Mm-hmm. Cool. So let's just start with a really super basic question.
Sure.
How does the voice work? And I'm gonna just throw that up there in case that's helpful for anyone out there. But why don't you just take us through, how that all works for us?
Awesome. Yeah, I love this cross-sectional picture. I think it captures a lot of the complexity. And it's not a simple question. It's a complex question, but we'll start really basic. So voice starts with air expelled from our lungs, expired from our lungs. That's where voice starts, air. And your vocal cords, which are located in what is outlined in green as the larynx, behind your Adam's apple right here, your vocal cords come together. They come together enough so that air that you're expiring out vibrates the surface of the vocal cords. So they want to be closed enough that it vibrates, but they don't want to be so closed that no air can get through. So it has to be kind of in that perfect position. And depending on the tension, which we'll get into, your vocal cords vibrate at a different frequency or different pitch. Mm-hmm. The air then goes through the back of your throat, your sinuses, your nose, depending on the speech formation that you're going for. And it has a certain character and sound. So it's sort of shaped by our upper anatomy, our sinuses, our tongue, our throat. But simply put, it's a lot of factors, including how much air you expel, the position of your vocal cords, the tension on your vocal cords, and what your upper anatomy is doing to shape that sound.
Okay.
So I hope that makes sense. Pretty simple, and there's so much intricacy with each of those steps.
Yeah. So then what gives us our unique sound? How much does the vocal cords themselves, how much are they a factor in what we sound like?
It's a tough question, but I think it depends on the person. So there are some professional singers that when we look at their vocal cords, there are some irregularities. There is a little bit of wear and tear, but that leads to a signature voice, if you will. The vocal cords maybe don't come together quite as nicely as someone who hasn't been through it. So there's slight gaps, which lead to this character of more of a breathy sound. And some people do just fine with that. They have a little imperfection, and it goes to show that we're not looking for perfect vocal cords. We're looking for functional voice, and that's the most important. But I'd say probably the majority of people are able to shape their sound beyond the level of the vocal folds. So above the level of the vocal folds, they are able to do things with the false vocal folds, which is an area just above the vocal folds, the throat, the tongue, the palate, other parts of the upper anatomy to shape the sound. So to really answer your question, I think that in some, probably the minority of people, the imperfections on the vocal cords lead to some character. But I would say in the majority of people, it's what he or she is doing with the upper anatomy that shapes the sound.
Gotcha. So when you're talking about people with cords that don't, come together fully, are you talking about singers tend to have this, or just sort of anyone, or is this a particular a singer phenomenon?
Yeah, that's an important question and distinction to point out. When we evaluate a performer, singer, actor, our biggest tool as laryngologists is something called stroboscopy. And what stroboscopy is a type of imaging that allows us to look at the vibration of the vocal folds, basically using a strobe light phenomenon. So it almost looks like they're moving in slow motion. Mm-hmm. What this allows us to do, beyond what other otolaryngologists do, is look at the vibrational pattern as well as the free edge of the vocal folds. And we can see with our own eyes slight imperfections, especially in the middle of the vocal folds, which we call the mid-membranous region, or the striking zone, where there's the most pressure when someone is singing. In an average person, they probably wouldn't notice slight imperfections in their vocal folds. They're able to do what they need to do, go to work, do all those things. But when we're talking about performers and singers, especially when we're trying to sing in our higher register, falsetto, even trying to sing softly and high, those slight imperfections get magnified dramatically.
Oh,
And so a lot of times the people coming into our clinic with slight imperfections are the people who really use their voice professionally as singers. But it even extends to people who use their voice a lot, like lawyers or teachers or other folks like that. So to answer your question, those imperfections are probably noticed more by those who really need their voice to be at the tip-top level.
gotcha. God, that's super interesting.
Yeah.
We'll come back to that later. There's the but I want to get through a few more questions before we talk about what we can do about these things.
Yeah.
What what part of our voice box gives us our vocal range?
This is fantastic. So our vocal range, at least the way I look at it, and I'm coming at it from as more of a physician, and so it might be a little different based on your definition, but vocal range is your lowest note to your highest note, what you're comfortable hitting. And when we have singers, we often ask them to tell us what they think their range is. And depending on what type of singer you are, you may have more difficulty trying to push the limits. And as singers, we're always trying to push our limits, either lower or higher pitches to really expand our range. And so it's a complex interplay of lots of different things, including our vocal folds, how much pressure we are able to generate from our lungs, if we're able to hold our vocal cords in a really fixed position while generating a lot of pressure. And then I'm just going to throw out two muscles, and not to get overly technical, but you've got a muscle called your thyroarytenoid muscle, which makes up the bulk of your vocal folds if you looked at them. And then you have another muscle that sits on the outside of your voice box called your cricothyroid muscle. We'll just call it the CT muscle. And that's a really important tensor. It elongates your vocal folds, makes it more tense. I think of it like a guitar string, turning the peg on the guitar string. That's a little bit what that muscle is doing. So the interplay between how much pressure you're able to generate, how much tension you can put in your vocal folds without your vocal folds breaking from their position, I think define a lot of your upper register, your upper range. So a lot of singers, that's really where the money is, like being able to get high. So being able to really tense your vocal folds in a way that is comfortable and doesn't create too much problems. The issue is, though, with that high register, slight imperfections, like I said, get magnified.
Mm-hmm.
On the opposite side of it, the lower register or our bass notes, you need your guitar strings or your vocal folds to be thicker, more loose. I think like a bass guitar string, like a heavier, fatter string, you want them a little looser. You don't want as much tension. So you'll see people when they're trying to create that posture, that sometimes they're even pushing the back of their tongue back to really push the vocal folds in a very loose posture to get as loose of a vocal fold posture as possible. So to answer your question, it's a complex interplay of lots of different muscles, and it's to get up there, to get the higher register, you really need to create a lot of tension comfortably. And to get your lower notes, you have to take away tension. And sometimes your anatomy just doesn't allow you to do those notes.
Uh-huh. And that was sort of my next question. Like, what makes like a bass sound super different from me, for example, when they sing? I mean, what physical characteristics do they have maybe sort of innately that I don't, for them to be able to sing that low?
Yeah. And there are people who dedicate their lives to this kind of science who probably can provide an even more granular detail. But, big picture, I think the guitar string analogy works. So the reason why men generally have lower pitches than women is their voice box tends to be bigger. So a bigger vocal fold is going to tend to give you a lower note. So the physical act of having a longer vocal fold creates that.
Gotcha.
A thicker vocal fold will also do that as well, and not having tension. So as someone goes through puberty, their voices tends to be higher, and also the position of the larynx too, as it descends lower, it may also change the frequency range as well.
So I've noticed that people's voices tend to get lower as they age. Is that something? Is that a real thing from your side? I've I mean, it's just like, oh, you're a soprano, in this decade, and then, they eventually become an alto a couple of decades later.
Yeah.
Is that a thing as you age that it's harder to sing high?
Maybe in the singing world, that may
Mhm.
be true, and an explanation for that might be that over time the muscle ability to generate enough muscle tension to create that higher pitch is lost. You've just lost some strength to get up there,
Mhm.
and also generate diaphragmatic pressure to do that. Interestingly, though, in the general population, um, older voices tend to actually be higher pitched, just speaking voices, not singing voices. And the reason is, at least we think, that a lot of the muscle tone has gone away. The vocal folds are not as strong. And so, in order to generate more voice, the person is using that CT muscle, like we talked about earlier, that turning of the peg. And so next time you see somebody in their 70s or 80s, not always, but they actually tend to have a higher pitched voice than me, because if you think of that really elderly person, it's kind
Interesting.
of weak, tremulous, and a little bit higher pitched.
Huh. Interesting. So what gives us our unique timbre to our
Mhm.
voices, right? So even though people can have the same range, they don't sound the same. It's why we can recognize people distinctly from each other. Um, yeah. Why do you think? Well, why is that?
I think it's a combination of anatomy and technique. So anatomy, we know that with the way our palate sits, our tongue, our sinuses, that sound vibrates throughout our body and comes out of our mouth. And so I'm sure that's a big part of it. The other thing is how we shape our sound. And so in our clinic at University of Washington, it's truly a multidisciplinary patient experience. So I'm the physician, surgeon in the room, but of equal importance is our speech language pathologist, who is looking at the techniques of voice production, thinking about therapy to help optimize vocal efficiency.
Holy cow!
And
That's
yeah, and so in terms of developing character, they're looking at that more carefully and looking at the strain patterns and how you're using their voice. So it's truly a combination of anatomy and the function.
Do you think it had something to do with? So I met with a voice teacher. I think her uh, Dawn Padula. Do you know of a Dawn Padula?
No, I don't.
But
Yeah.
anyway, she said or that if we sort of had our if we all cut our heads off and spoke, that we'd all sound the same. It would sound like if it was just our voice box kind of making noise, it would sound like a trumpet with just the mouthpiece. And what gives us our unique sound is sort of our head and the way we use it. Um, and
It's
that
interesting.
seems to resonate to me, that the flesh in our head contribute to it's like, because when you sing, we're just not singing one pitch, we're
Right.
singing, there's a sort of overtone series above it and below it, actually, that we're engaging. And the idea that what gives us our unique sound and timbre is what portions we're activating in those overtone frequencies. um so I guess, have you I guess I put that to you, like, does that make sense to you?
Yeah, no, I think that's very well said. Kind of a graphic way to explain it, but yeah, I think that makes sense to me. Um, and it's a fantastic point, because as voice doctors, we're very focused on the voice box. We're very focused on the larynx, because that's the first place that sound is produced, kind of upstream from everything. So we're often thinking about that. But it really emphasized why care of the professional or performing voice is really multifaceted. We're looking at one part of it, but good singing instruction, speech pathologists, a lot of different people are integral to the whole equation. It's not just one easy fix from the vocal cord level. And to further complicate it, slight imperfections in the vocal cords or issues that develop over time can lead to compensation. We do things at the level above our vocal cords. We might strain more, or do something, a little abnormal that leads to vocal fatigue and strain to compensate for what's happening at the vocal cord level. So I think that analogy is good, and I think it makes sense, and it's a good thing to always keep in mind.
Yeah, I mean, I think when I from a singer's perspective, one of the things we're most concerned about is projection and singing over, a large orchestra, and having enough facility to do that. And perhaps more attention needs to be paid to your voice box to make sure the mechanism isn't or I should say is working properly. But a lot of attention is normally paid to how your technique can engage more overtones, basically, so you can project. I don't think it's opera singers tend to be really impressive that way. They make so much noise. Like I couldn't yell. My biggest yell couldn't go over an opera singer. I mean, that's how enormously loud they seem to me. Like, I don't know if you've ever sat in a room with one, but
Yeah.
singing "Happy Birthday," but
Yeah.
it is really quite something.
Yeah.
Um, but yeah, it's there's something about it's like a challenge, or that's sort of what I feel like voice lessons are all about, is sort of accessing different spaces and getting different overtones in there. Just real quickly, hey Renwick, thanks for the question. Why don't we transition to Renwick's question here, actually, since he just threw in. Thanks for tuning in. So Renwick says, I'm the bass section leader and cantor with me at Trinity Episcopal Parish. I'm 66, and he seems to be losing his low range and having a hard time singing. Is this due to age?
Yeah, it's possible. It's also possible that it's not. And that's where sometimes an evaluation by a voice doctor, especially in a multidisciplinary fashion, is helpful. Because we can see what's happening at the vocal fold level that's leading to the loss of your ability to hit those notes. Is it a problem with the posture? Is there some muscle tension that's keeping the vocal folds in a more open position, so you're getting air as opposed to sound? And so, loss of your lower range could certainly be because of age, but it's also entirely possible that there is some changes to the way your voice is coming out, maybe compensating for some subtle changes to the vocal folds that could be reversed with the proper, voice therapy and instruction. And it's something we are always thinking about constantly, what we can do from a procedural, medical, and even therapy perspective to get the range back to where it was.
Mm-hmm. Good. Thanks for that. What what can we change about our voice through training and surgery? What about its timbre? We were talking about accessing overtones, right? So in my dream, I am a bass, and I've heard basses that can just project super easily. I think it's because of like whatever their timbre overtone makeup is there, and it's kind of like magic. What things can I do either through training or through surgery to get that? What can people do to? I think a popular one is changing their range. Um, People that are going through some transition, might want to have a more higher voice or lower. So what sort of things can we do about that?
Yeah, it's a good question, and it's probably an evolving question in our field. Generally speaking, we prioritize voice therapy as the first line treatment for a lot of these things, and the reason is because there's low risk to voice therapy, whether it's changing your muscle tension, strain, being able to more effortlessly access higher ranges or lower ranges. Therapy is generally, I'd say 90% of the time, especially for performers, a good starting place. It can be therapeutic, and it can also be a little bit diagnostic. It can help us determine, well, what truly is the deficit? Is it with pitch breaks that happen at very specific places that we need to get rid of? Is it really the higher register loss or the lower register loss? And really drill down on that. And when you see a lot of the speech pathologists, it's generally, 3 to 5 sessions that last about an hour. So there's a lot of time to go over a lot of those details. So, that could certainly be a helpful place to start.
Mm-hmm.
Now, when it comes to surgical approaches to changing the voice, that's a whole topic that has a lot of complexity and certainly evolution over the last 15, 20 years. But I'd say still in my practice, 90, 95, probably more percent of the time we're doing surgery, it's because there's something that went wrong. There's something called dysphonia, or something that one used to be able to do is not able to do now. And so we are interrogating the vocal folds in clinic and sometimes in the operating room to reverse a lot of the changes, whether that's a lesion, a benign lesion, like we've all heard of polyps or cysts or nodules, or address some scarring, or other pathology or problems with the vocal folds. But in terms of fundamentally changing your range, like let's say, you have a lower range and you want to have a higher range, and for a variety of reasons, and therapy isn't quite cutting it. There are procedures that can do that, but those are pretty drastic. And as someone who's a performer or singer, I think one would need to think long and hard before jumping into that kind of procedure to really know what's the benefit risks of a procedure like that.
Mm-hmm. Great.
Yeah.
So this next question, I don't know. It'll be interesting to see your answer or hear your answer to. But I've always been, from my experience, I've had a lot of voice lessons from a lot of voice teachers advocating different approaches, and which I'm sure like have worked well for them. What hasn't always been clear to me is what we can expect as a student. Like, what's a reasonable expectation, a reasonable goal to have going into voice lessons? You know, what what's a sort of healthy expectation? There, when you're young, you think, oh, I just need to do this, and I'll end up sounding like this. And there are, as you mentioned, like physical limitations, and so I'm wondering, what you think we can expect out of like good voice just training. Like less of surgery. What we can expect. I mean, can I be an opera star? Obviously, you can't really answer that now, but this is sort of what a singer thinks, I think, through training. And sometimes worry that people push themselves too hard, doing weird stuff, whatever their teacher's telling them. I think I heard one where, that the teacher like put their thumb on their throat and made them sing really high, and it hurt. But he had to sing that way for like the whole the whole lesson. Um, there are also things like with the larynx, larynx position. There's a lot of talk about that. Used to be low, and then now it's like I'm hearing it now. It's kind of like relaxed, and so yeah. What do you think? What do you think about all of that?
I think there's a lot to unpack there. I think good singing instruction is generally helpful. I feel like when we see singers in our clinic who've had formal instruction versus not, you can immediately spot the differences in terms of not just how they sing, but how their phonatory posture, what their vocal folds even look like, how they're using accessory muscle tension to generate the sound. So I think formal singing instruction is helpful and a very needed part of the overall equation, beyond what I do, what the speech pathologist is doing. But I do hear you on that about like people pushing themselves beyond maybe what they're capable of. And, we see young people in our clinic who, really want to do something, and they come in and they have really beat up vocal folds, and they need a week of complete voice rest to sort of reset. And it's still an area of ongoing research, but probably the wear and tear of getting edema or swelling on the vocal cords and then having to get rid of that with time, voice rest, steroids, all those things, probably that repeated trauma to the vocal folds decreases some of the pliability or the flexibility of the vocal cord lining over time. And so I think it's good to listen to your body. And, if and I think our speech pathologist I work with probably can answer this even better than me, but I think generally speaking, it shouldn't hurt when you're singing,
Yeah.
and a lot of people come into our clinic and say, I thought it always should hurt, when I'm singing these notes. And,
Wow.
and no, it shouldn't always hurt. The pain is not part of singing. It should not be painful. And is it a limitation with your anatomy? Or is it a problem with singing instruction? Or is it something that we can help with from a speech pathology perspective to get your voice out in a more efficient way is always something that we are considering. But I not to overly generalize, but I feel like it's the young performer who's trying to really push themselves that we see with a lot of strain and vocal pain, and they have a lot of mental fortitude to keep pushing and keep going for it. And it's just a vicious cycle, and it just gets to a point where and also when you're singing with technique that is very high in strain, sometimes you have to unlearn that. And that's why the speech pathologists I work with are really important too, because sometimes people get this muscle tension that is very, very integral to the way they perform, way they sing. And to unlearn that takes a lot of deliberate treatment effort, which can be months or years of therapy.
What are, say, like the top two common vocal problems you encounter from singers?
Without question, number one is muscle tension dysphonia. So what is muscle tension dysphonia? So it is the use of our accessory muscles around our throat that are abnormally tense with voice or singing voice production. That can be primary. And what primary muscle tension means is it's muscle tension without an underlying cause. So sometimes, especially younger people, can have muscle tension because they're really trying to push the limits of their voice, but they don't have anything wrong with their vocal folds. They're not compensating for something. Secondary muscle tension is where the person is compensating for some maybe weakness, or maybe they have some scar on their vocal fold. And so in order to generate the same level of voice, they have to compensate with other muscles around their throat. So that's where we often see that the throat, the voice box, tends to go up because we're recruiting a lot of these muscles above our larynx to pull it tight. And there's a space right on top of the level of your larynx or your thyroid cartilage called your cricothyroid. I'm sorry, your thyrohyoid membrane. And in people with a lot of muscle tension, you can't even get your fingers in there. It's just so tight. It's like a rock. And that's where our speech pathologists really work. Is this a primary muscle tension that we need to get rid of this strain, or is this secondary to something? And that's another thing we're thinking about. Do we need to address something underlying that might be causing this? And as a really quick example, it's rare, but we see it in our clinic, vocal fold weakness, paresis or paralysis, where one of the vocal folds is not moving as well as maybe it did in the past. And one very common compensatory mechanism is this muscle tension. So that's an example of like secondary muscle tension. So I would say, to answer your question, that is like the big thing we see. And it's usually a part of a lot of different things, if that makes sense. Like they may have a polyp and a muscle tension, or they may have a scar and a muscle tension. It seems to be superimposed on a lot of patient presentations.
How do you know if a singer is singing with too much tension, or if their folds aren't connecting? Like, what sort of symptoms can we look out for?
Yeah, our stroboscopy can help us. So stroboscopy is that imaging where it's slow motion wave. But I always emphasize with singers that that's a tool. That's a tool to help us see your voice box. The most important thing is how you are functioning. So if you are able to hit all the notes you want without muscle strain, loss of vocal fatigue, you're able to do what you need to do, and we look at your vocal cords and you're showing a lot of strain pattern, then that's okay. If you're able to do the things you need to do and it's not creating a bunch of pain or issues and not damage to your vocal cords, that's fine. So it's really patient driven. What you're feeling is the most important. And the pictures that we see, the videos we take of your vocal cords, your throat, give us clues as to what we can do to get you better. But if you're feeling awesome and you're hitting the notes you need to and you're not having pain anymore, then the pictures are secondary. I hope that makes sense.
Yeah. What's happening when singers get vocally tired? So after a long day of singing, I used to sing countertenor, and so I would sing in my falsetto a lot, and I would just be gone by the end of the day, or maybe just after like 2 or 3 hours of singing.
Yeah.
My voice starts getting raspy, a little fuzzy. What's happening there, and what should we do about that?
Yeah, it could be a couple things. One is that the muscles, whatever muscles you're using to generate your sound, are just getting tired. It's like the fiber type of laryngeal muscles or voice box muscles, tend to be sort of like the type 1 fibers. And what that means is they go on for a while, but they don't fatigue, as easily. There's a combination of fibers that make up your vocal fold muscles. So the muscles could just be simply getting tired. They just don't have the same power that they did when you first started singing. Another possibility is that over the course of singing hours and hours, you've developed just a little bit of swelling at the striking zone, the mid portion of the vocal cord, where there's the most degree of impact. And that slight degree of swelling, outpouching, edema.
Can you point that out here on the photo?
Sure. Hopefully this works. I'm not sure if you can see, but where the larynx is, and you see the vocal folds, it's in the middle portion of that.
Okay.
That's where the vocal folds sort of rest. And you can see a little outpouching, a little swelling. We call it mid-membranous fullness. And when you have that, you can almost think of it like little mutes on your guitar string. It just dampens the vibration.
Hmm.
So now you have to work even harder to get the same vocal intensity and pitch, because now you've got little weights on it. And then when you go to sleep, over time, that swelling goes down and you wake up and that swelling hopefully is gone. If you didn't talk for a week, it would also go away. And that's what steroids are doing. Steroids are taking away some of that swelling in the striking zone. And so probably over the course of several hours, you've developed a little bit of edema, fullness, and so you're just having to work harder, and it's more fatiguing.
Mm-hmm. Gotcha. So singing through COVID, we can't do it. We're starting to a little bit. Can you just tell us why that was a huge problem, and if we should still be worried about that?
Yeah, it was something that was very important to us and continues to be very important to us, because when we are seeing patients in clinic, we're having them sing sometimes with a scope in their nose and looking at their throat. And the question is, what activities and procedures are aerosol generating? And, I've read case reports and, news articles about people singing, and it was sort of a big event where it generated a lot of aerosol particles that led to infectivity of the virus. So I think there certainly is a risk with singing in closed spaces. We've done, some modification of that in our clinic. We're wearing full protective equipment generally when we have people sing or when we're doing a scope exam in the nose or in the throat, just to protect ourselves. And so, I think as the rates of people that are getting infected with COVID go down, I think it generally makes the whole thing safer. Probably outdoor singing is less risky than indoor singing in closed spaces. But, if you look at particle counters when people are singing, you're definitely generating aerosols that might infect other people. And, I wish I had a firm answer like, you should sing for 20 minutes, not 40. I don't have an answer like that, but I think they are real concerns. But I think if you take the right precautions, you can be safe. And throughout COVID, we've been seeing singers, and this is a little sidestep to your question, but sometimes this is a good time to get your vocal folds checked out too.
Mm-hmm.
And the reason I say that is because a lot of people are not performing, and it's sort of a quieter time, and things are generally in a good zone right now. And so, it's one thing to see people when they have acute changes or sudden changes in their vocal folds, but in some ways, the pandemic has allowed us to see a different cross-section of singers where they're just here for an evaluation of their vocal folds and vocal technique.
Mm-hmm. Yeah, I'm super interested. I totally want to do that. I've always wondered, if all my stuff's working right.
Right.
Good to check that out. What about gyms? So I think of singing, aerosol. Okay, it's because we're exhaling a lot. It's not. I feel like it's not too unlike the gym, where people are just huffing and puffing, in a space, in a closed space. Do you find gyms being also risky in that same sense?
Potentially, I think it's a great analogy. It's a similar sort of thing. You're moving a lot of air, and so you're not the ability to sort of project those particles are probably high in a gym. I think maybe the difference is, well, I guess it depends on the gym. Hopefully, you're a little more spread out, and you're not directly,
next to it. Yeah.
Yeah. So it's possible, but fortunately, I think hopefully things continue to trend in the positive direction, and we're able to get back to the same things we were doing.
Okay. Why is it so hard to sing when we have a cold?
Yeah, that's a great question. And it's similar to why you have trouble singing or more trouble singing after 3 hours of singing.
Mm.
Laryngitis is inflammatory, and you're getting some inflammation on the undersurface of the lining of your vocal fold. So, very generally speaking, when we think of our vocal folds, there is the body, which is the muscle and some of the fibrous covers, and then there is the cover or the mucosa. So that mucosa or cover is free to vibrate, and the body moves its position. And unfortunately, when you have a cold, some of that swelling gets stuck in the cover, in the
Mm.
lining. And so now you've got this more bulky cover, and you have to work harder to push it, to vibrate it. And your pitch tends to drop because it's thicker. It's a thicker vibrating surface. And so the fundamental frequency that's coming out of that tends to be lower. So interestingly, when you have a cold, I don't know if you've noticed this, but you might be able to access a lower range than you
Yeah.
could otherwise.
And actually a freakishly high one.
Oh, interesting.
Yeah, my
I don't know how to
falsetto, I
explain
can hit
that,
a
but
I can hit
cool.
a high C,
That's
which
awesome.
is uh,
Yeah.
strange.
Yeah, if we could just get people sick all the time, then we could help them out when they're trying to get this low voice.
That's right.
Yeah, and sometimes, just as a side note on that, like with people with weakness, one really interesting thing that perks our ears up are they're like, yeah, I'm breathy most of the time, but when I get sick, my voice is better. And
I am a god when I'm sick.
yeah, and it does make us wonder, well, do you have some vocal insufficiency or some space between your vocal cords? You're not able to bring it together. But when you have that swelling from a cold, now you're suddenly able to bring your vocal cords together.
Mhm.
So it's a good point. Another thing that can do that is when people have reflux, acid reflux, that is irritating their throat.
Oh yeah.
In severe cases, we call it LPR, or laryngopharyngeal reflux. So stomach acids travel up the esophagus, irritate the throat. It happens more commonly when you're laying down, when you're flat. So it's just easier for stuff to come up. And not a lot of people, but some people will have swelling of their vocal cords because of that. Smoking is another thing that can do that. Smoking can drop your pitch. It creates some edema on your vocal cords. Um, People who are smokers have a very characteristic sound to their to their voice. And when we look at their vocal folds, they have almost a characteristic look. Their vocal folds look very kind of like pillows. They're just very puffy and very swollen.
Oh, interesting. So I think as we reach the end of this, whoever's out there listening, you're welcome to chime in with any questions you might have. I guess I'll start this out while people kind of type it all in. How um, should men sing in their falsetto register? How do I know? Uh, is that like healthy? I guess when I make this noise.
I think generally, and I'm probably not the expert of some of the voice production stuff, but I think generally it is healthy. There are people who sing in a lot of in falsetto. I think the things to keep in mind is it sustainable? Are you able to do this for a long period of time without getting vocally fatigued? And is it leading to any pain, strain in your neck? And if you're able to check both of those boxes, you're able to do it for a while without strain and feeling tension and no pain, I think my answer is fine. It's fine to do that because it's really just a posture. It's a way you're holding your muscles engaged in a certain way and really tensing them. And the other thing is, as a singer, if you're able to do falsetto softly,
Hmm.
that is a really good indicator that the lining of your vocal folds is probably in pretty good shape. That's the
Oh,
hardest thing to
interesting.
do. Soft, falsetto, high pitch falsetto softly is very difficult. And if you're able to do that, that goes to show that the lining of your vocal folds is probably in pretty top-notch shape.
Wow, that's great. I've never heard that before. That's a nice thing we can all try for us falsettists out there. In
Yeah.
early music, often you'll use male altos for a timbre instead of female altos. So that's good to know. A lot of voice teachers talk about breathing. There's a lot of attention toward how you do your breathing and how you exhale. Um, how how important is that to you, or how important do you think that is?
Extremely. I'm coming at it more from a simplistic perspective, relatively, as a surgeon looking at things. But our speech pathology colleagues really think about breathing at a level way beyond me, because ultimately we're talking about how to power your voice, and there are ways to power your voice through breath and also through your neck tension. And sometimes it's a trade-off. Like, the less breath support you have, the more tension you have. You think of those people who speak with glottal fry, for example. They have like no breath support. They're hardly expelling any air. It's very shallow, but they're generating this sound with very loose, it's kind of an interplay between loose vocal folds and a lot of tension, a lot of tongue base and things like that. So sometimes clearing the voice up is as simple as just providing better breath support. And our speech pathology team here is really excellent at thinking about those things.
Mm-hmm. Renwick, will we be able to come back soon as a choir if we're fully vaccinated? I have qualms about indoor spaces. I mean, I think that's half question for me as the choir director.
Yeah.
These decisions involve not just me, but our bosses, as it were. And I think the idea, Renwick, is maybe hopefully September, assuming things keep trending for the better. But yeah, I mean, no doubt, not everyone will be on the same page, on the same comfort level, coming back singing, and we'll all just kind of have to navigate through that and be as respectful as we can. So what are you working on? I sort of touched on this at the very beginning, but like, so what are you currently like? What are you working on like right now? Like, what is your focus and piquing your interest these days?
Yeah, clinically, we're really working on this performing voice clinic. Wednesday afternoons, we reserve a few hours for just performers. And we're really trying to make this a truly multidisciplinary experience, and seeing people when they have voice problems, but even when they don't necessarily have voice problems. So really getting that going. I work with Julie Rosenzweig, who's a speech pathologist, and we work together. And the really cool thing is we're able to get singers in, if they have sudden voice issues, generally within 24 hours. And so this is a service that we hope helps people if they have sudden changes in their voice, that we can troubleshoot issues, provide some quick therapy or treatments if necessary.
Great.
And then from a research perspective, it's different. I'm very interested in the aging voice.
Uh-huh.
So what happens to us as we get older? We see things. We see that the vocal cords look a little thinner. They don't have the same movement. They don't have the same pliability or flexibility. And so at the neuromuscular level, what's changing to those vocal folds that leads to that? And so it's a lot of basic science and some in-lab work. But and I split my time 50-50 between the clinical practice, surgical practice, and the basic science lab stuff. So that's what I'm working on.
Cool. Is there a place where we can follow your work there? Do you publish stuff? And
yeah, you can look for on our otolaryngology head and neck surgery website at the University of Washington. I think other like Google Scholar, other things you can probably follow me or look at work. And then, yeah, we're not as social media savvy in the research world, but
So you have
getting
better
there.
things to do.
Yeah,
That's
yeah,
right.
yeah. I need to get on Twitter. I think that's the key. I'm a decade late, but
Yeah. um, question. The idea that pop singers don't sing as properly as classical singers gets thrown around a lot. You mentioned that you can often tell if singers have had some voice lessons. Singers like Adele have to take long breaks to deal with vocal fatigue. I suspect it's a myth that pop singers don't sing as well as classical singers, but do you find that to be true in general?
yeah, really, really nice question. And I think if you ask 50 voice doctors, you'd get 50 opinions on this. So I'm definitely just going to give you my opinion. I think classical singers um, tend to have less problems with their vocal folds. They tend to use better technique than the pop contemporary singers. And I think that the pop contemporary singers tend to have more uh, changes to their vocal folds that might be because of technique. So I don't think it's necessarily a myth. I think there is something to that. And when I was at USC, we would do these free vocal screenings, and we had pop singers and we had classically trained singers who'd come in for this. And I think somebody published on this, or maybe it's in the process of being published. But it was really interesting that we found more lesions, more problems on the vocal fold surfaces in the pop group than the classical group. But the classical group was way more concerned about their voice. They were coming in it with way more level of anxiety about their voice and what we're going to find and what does this mean and what is this small little thing based on pre and post surveys. So really interesting,
Yeah.
not scientific, it's just a sampling of 20, 30 people. But I think in general, classical singers tend to have more of a training, not always, but they tend to do and tend to have better looking vocal folds.
Yeah. Great. Well, thank you very much for your time. Before we end, how can so I feel like I want to encourage everyone to get their folds checked out. Um, it sounds like we don't have to wait till we're sick or broken to do that.
Yeah.
That we can kind of do it now while singing isn't at full speed ahead yet. How do we get an appointment? How does that all work if we want to get
Sure.
our?
So if you go to University of Washington otolaryngology, head and neck surgery, or ENT, you can look at patient appointments and call, and then certainly let the scheduler know that you are a performer and want to be seen in our performing voice clinic. And we generally put people Wednesday afternoons, but there are other voice doctors like me who are happy to see you on other days. And we can sort of do a well checkup where, even if there's nothing wrong, just make sure that things are looking good, see if we need to add any voice therapy, and get some sense of how things look at baseline. So that if there ever are issues moving forward where you have acute or sudden issues with your voice, we have a baseline. We know what things look like before, and we can go from there.
Great. Well, thanks so much, Neel, for your time. You've been most
Thank
generous
you.
with it,
Great.
and best of luck with all the important work you're doing out there for us.
Thank you.
And look forward to hearing from you in the future. So,
thank you. Had a great time. It was great to connect with you, and great to connect with all of you. So, looking forward to chatting in the future.
Great. Thanks.